Hello, it's Dr. Thompson. Today we're going to be going over the results of your x-rays and any other tests we may have done. I just like to talk to you a little bit about what's going on in this process and where we started before we do go over that. So if you remember several months ago, you started that plan to correct your nerve system as much as possible and your spine, including your spine. Also, now our goal was to eventually try to get things as normal as possible or as close to normal as possible. So our goal is to get everybody back to perfectly normal or to where there's not a change from one x-ray to the next, and we know that's as good as it's going to get. But hey, an 80% correction, 50% correction, that the more pressure we can get off your nerve system and allow your body and brain to communicate to the rest of your body, the healthier you're going to be. Now, again, remember when you first came in, you may have had a lot of symptoms, and some of those symptoms can be gone, but never fall into the trap of thinking that because your symptoms are gone, things are fully corrected. Remember, every disease process known to man, the last thing to show up is a symptom, and the first thing to leave is a symptom. So people really are counterproductive and they get into trouble when they start feeling better and they stop doing what they need to be doing. So things that can cause abnormal function and a worsening of these subluxations is stress. It could be how you're working, doing things repetitively, if you haven't changed your sleeping habits, if you're having abnormal poor postures or loads. So there's a lot of different things. The degree to which your x-rays can change also depend on a lot of different factors. It can depend on things, well, obviously, such as, how well did you make your appointments? Were you doing all of your therapy at home? Have you started implementing some of these other healthy lifestyle choices, from our health coaching program? I mean, you start putting good foods in, you got the right ingredients to heal and repair at a faster level. The same thing with getting rid of toxins. So have you been doing some of that? Also, how much damage was there to begin with? First and foremost, how misaligned was your vertebrae, and also what phase of degeneration were you in? These are all things that influence how much correction we're going to get. So, however, I can't reiterate enough that any positive change back towards normal, I mean, your spine, we're talking millimeters, can make drastic results. So, and improve your health immensely. So, a lot of times, even when we're seeing things, it's a slow process like bracing your teeth, but you're seeing things slowly. If we're going in the right direction, that is all positive and all positive. So no matter where you are at this time, it's critical to continue working and improving on getting your nerve system as healthy as possible. Because remember, your nerve system, your brain controls every cell, tissue, and organ in your entire body. What you're doing right now is the missing ingredient in healthcare. And we see it over and over and over. People they come in because they have pain, but then we not only do we get them out of pain, we start working towards function and taking pressure off those function fibers. And that's when people's bodies start to heal and repair and heal and repair. And that's when their health really starts making great strides. So wherever you're at, make sure you continue on your journey to get things fixed as much as possible. You will not regret it, and you'll be healthier and much happier. We'll talk to you soon.